In today's video, I'm going to give you my 4 very best tips to help you last longer in bed and stop premature ejaculation. So what we're waiting for, let's get on with it. Okay, let's first discuss what is considered premature ejaculation, okay? Just to make things very clear, the average time for sexual intercourse, as in from the start when vaginal penetration occurs up until ejaculation, is 5.7 minutes. 5.7 minutes is the average time, okay? When we're talking about premature ejaculation, we're generally seeing people finish much quicker, usually between 1 to 2 minutes, okay? So that's just some numbers, just so you're aware of what is actually considered premature ejaculation. The reason behind why premature ejaculation happens, there's many theories out there. Some of them, for example, are abnormal serotonin production is causing it. But there's many different reasons and theories behind it. The most important thing is there are things that you can do right now even to help with this. There's treatments available as well, and we're going to discuss them in this video. So now let's run through them all. So let's dive straight into tip number 1. This is called the squeeze or the stop-start technique, okay? This is a fantastic technique that helps with premature ejaculation, and best of all, you can do it straight away from home. Right, here's how it works. You're going to first speak to your partner, make them aware of this, and the way it works is when you're having sexual intercourse, when you're about to come to an end, so when you feel the urge that you're going to ejaculate, you need to stop, and then either you or your partner can grab the base of your penis and hold it tight. You hold it tight, it could take 30 seconds, it could take a couple of minutes, until your penis starts to soften a little bit. Once it starts to soften, then you can let go and restart. The aim is to try and do this 2, 3, 4 times during sexual intercourse, and then of course finish at the end. This is a really good technique that helps with premature ejaculation, helps to give you that control as well to last longer in bed, and over time you'll find what works for you. Straight on to tip number 2, let's talk about topical anesthetics. So we have creams, we have numbing sprays, okay? These are applied to the area locally, and they basically numb the area, make it less sensitive, and it basically slows down the signaling to the spinal ejaculation center, helping you last longer in bed. So they can be very effective. Usually they're applied about 20 minutes before sexual activity, but it's always a good idea to speak to your medical provider about them before using anything like this, just to make sure it's safe and suitable for you. And straight on to tip number 3, let's talk about medication for premature ejaculation, in particular, antidepressant medication. I know it sounds strange for premature ejaculation, but certain types of antidepressants called SSRIs, that stands for serotonin reuptake inhibitors, can basically delay the reabsorption of serotonin, and this is going to help premature ejaculation. We can see improvements within 5 days of taking this medication, so it is pretty impressive stuff. However, with any medication, always do speak to your medical provider about them so they can go through how it works, the risks, the side effects, all that kind of stuff. So let's move on to tip number 4, pelvic floor exercises. This can be fantastic at strengthening your muscle core, okay, which is all going to help with coordination and control of your ejaculation. Basically, by strengthening our muscles, we have more control. It's going to help basically delay things and help you last longer in bed. There are many different things that you can do, and you can do them at home. I'm going to leave a link to a really useful NHS pelvic floor exercises list where it goes through things in detail, all in the description. Definitely do check it out and give it a go. There's definitely nothing to lose here. Now, please do remember this very important point. If you are experiencing changes in ejaculation, please always consult your medical provider. There can be many different causes for it as well, from psychological to also physical, all right? So it's really important that if you do experience any changes, always speak to your medical provider. This is the number 1 thing that you need to take from this video. Now, if you want more information or treatment options for a particular condition, then let me tell you about Dr. Fox, who are very good friends of the channel. Dr. Fox is an online doctor and pharmacy who are ready to help with over 30 different medical conditions. To learn more about Dr. Fox and their fantastic services, I will leave a link in the description below. Definitely do check it out. Dr. Fox, thank you for being our trusted sponsor. So I really do hope that you found these tips helpful. As I said earlier, please always speak to your medical provider as well about any health conditions so they can give you personalized medical advice. And as always, thanks for watching and sending awesome vibes.